Good morning and happy Tuesday. I'm Jenny Gallagher with Joyful Heart Healthcare and Keto Nurses. And yes, I'm in a different place this morning. I'm out in my camper. So we'll give everybody just a few minutes to see the notification and sign in, get logged in and set up. And we're going to talk about insulin resistance. We haven't done that in a while. And we haven't fully discussed its implications for health in a long while. So I thought we would do that today. I shared a graphic on my social media page just a little bit ago. And that is just a brief synopsis of how insulin impacts health. So we're going to talk about some of those in detail. So grab your coffee. I have mine. And share the video or save the link to share for later. And we are going to talk about insulin and its impact on health. So, good morning, Debbie Brown. Beautiful day here in West Tennessee. Yes, it's pretty here in San Antonio as well. Still a little bit on the warm side. It was like 85 yesterday. But that's definitely not terrible. I think Friday or Saturday it's supposed to be 90 or 95 again. So still a little warm down south. So I am going to open up my computer. I didn't get that done before we logged in. But we're going to talk about insulin and its impact on health. And so feel free to ask questions, type those in the comments as we go along. I'll stop and answer those on occasion. Good morning, Sandy. Good morning, Mary. I'm glad y'all are here. I mentioned just as I signed on, I shared a graphic on social media just a little while ago in preparation for this discussion about insulin resistance. And so I put insulin resistance in the middle and arrows pointing out to lots of impacts on health. So if you have trouble with insulin resistance, you may have some of those symptoms or those problems. And so we're going to talk about some of those. Sandy says, hello, chilly of our morning and then it warms. Yeah, chilly in our morning and then it warms up. Yeah, it's 55 here right now. So it'll warm up to about 85-ish later today. So good morning, Valerie. Glad to have you. Good morning, Jenny Tab. I haven't seen y'all. Y'all are new followers. So good morning. Glad to have y'all here. So this morning's topic is about insulin and insulin resistance and its impact on health. So first off, you have to understand that insulin is not necessarily a bad guy. We have to have insulin to perform various tasks in the body. One of its most important responsibilities is to move glucose, which is blood sugar, out of the bloodstream. Blood glucose that is high is dangerous to cells. So insulin's job then is to come alongside and truck that glucose right out of the bloodstream to avoid toxicity. When glucose levels get so high that the insulin can't keep up, we call that diabetes. So there are two problems here. One is a glucose problem, and we call that diabetes. One is an insulin problem, and we call that insulin resistance. Insulin resistance or elevated insulin happens when there is so much insulin pounding on the cell membrane, like just pound, 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 pound all around the cell membrane, that there's too many signals, too much data for the cell to respond. And so the cell just goes, no, you can't come in. And so it's more complicated than that. It's a very complex chemical and physical response. But basically that's what it boils down to. It's just too much information, and so the cell literally just closes off. It's kind of like when the spammers come to your Facebook account and you block and you block and you block and you block them. You don't want them around. And that's what happens with insulin. When there's so much of it, Sometimes it's even faulty insulin. The body makes so much so fast that it's ineffective, or it's not properly prepared. The molecular structure might be somewhat skewed. And so that presents problems for efficiently functioning insulin. So the normal job is for insulin to be released from the pancreas, come alongside the glucose and say, hey buddy, you don't belong here, let's move you into a cell. And that cell is adipose tissue. Those are fat cells. That's why we gain weight. Insulin's job is to store fat. So if you are struggling with insulin problems, you are likely going to see weight gain, because that's how insulin works. Its job is to move glucose out of the cell, out of the bloodstream, blah, 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 maybe I need more coffee, and store it as fat. That is what causes us to gain weight. And so that is why I generally teach people to eat a very, very low carb, grain-free eating plan. The lower your carb intake, the lower your insulin gets. Let's think about this logically. If you consume carbohydrates, they all break down into glucose. What happens to that glucose? Very little of it gets utilized in ATP or energy production. The rest of it floats around in the bloodstream, triggering a variety of responses that make the body say, hey buddy, you don't belong here. This is too much glucose. Only about 4 to 5 grams of glucose, that's about 1 teaspoon, belongs in all of the blood in your entire body at any given time in a 24-hour period. 5 grams, 1 teaspoon. So there's no physical need, chemical need, molecular need, cellular need for tons of carbohydrates. Absolutely zero need for all these carbs and grains that we typically consume in a standard American diet. So when we consume those carbohydrates in excess, we wind up with high insulin levels. What's an insulin level? Well, we can test insulin. I have so many patients, when I first have conversations with them or interact on social media sometimes with people, they say, well, my insulin's fine. And I'm like, well, what is your level? And they say, my A1C is 5.1. Okay, but that's not your insulin level. People don't understand. Even nurse practitioners, physicians, physician's assistants, nurses, certified diabetic educators, professionals in healthcare do not understand many times that an insulin level is nowhere near the same as a glucose or an A1C level. Those are 3 different levels. So if you are asked about an insulin level, that's what it's called. It has no other name. It is simply an insulin level. Mainstream insulin level range is about 3 to about 20 or 21, depending on the lab. That's a huge range. And what we find in the low carb world is that an insulin level higher than 5, even higher than about 4.7 or 8, is really hazardous to health. We want an insulin level to be about 4 or 5 or less, because the higher it is, the more symptoms people have of insulin resistance. The higher your weight goes, the larger your waist circumference gets, the more hormone imbalances you have, the more fatigue and brain fog people experience, the more inflammation we typically see in patients. Your anxiety and depression symptoms will worsen. Like, insulin drives so many symptoms, it's really crazy. When I do patient intakes, when I see patients for the very first time, I send them what I call a thyroid questionnaire, symptom questionnaire, but it's really more than thyroid. That's what it was called when I found it online and adapted it to my practice. But it really covers every body system, and it's a really decent review of body symptoms from head to toe. When patients answer those questions, it gives me a really clear picture of metabolic function or dysfunction. And so it really does help when we as practitioners see your written symptoms. When you report your symptoms on those kinds of questionnaires, we're able to easily identify a lot of your symptoms. When patients report joint pain, for instance, one of the things I ask about joint pain sometimes is, tell me a little bit about your stiffness, your joint pain, your muscle aches, muscle cramps. Tell me how that bothers you. Tell me how it impacts life. Tell me more about that. When I ask it that way, patients are more likely to share more information about their pain and discomfort and their problems, rather than me say, do you have joint pain? A lot of times those yes or no questions cut people off, make patients feel like I really don't want to know what their symptoms are. And so they will often respond with, not really, or I don't have anything like that. But when I have the questionnaires, they're answering privately in the comfort of their own home. They answer honestly. And so then when I have the questionnaire at our visit, I can look through and say, tell me a little bit about your sleep problem. You said you're having sleep problems. Insulin resistance messes with sleep patterns. Who knew? Those of us in more functional care know that. Insulin messes with sleep patterns. It messes with joint pain. It messes with brain fog and cognition. We even call some Alzheimer's type 3 diabetes, because we know that high glucose and high insulin impact cognitive thinking skills. So insulin resistance is a huge problem nationwide, worldwide, in most every culture. So if you are wondering if your symptoms are driven by insulin levels, get an insulin level tested. If your prescriber won't order an insulin level, go to onyourownlabs.com or walkinlabs.com. You can order your own labs in almost every state. There's 3 or 4 states in the country that won't allow you to do that. If you live close enough to the border of those states, you may be able to cross the state lines and get those done in another state. If you can find a relative or friend's address you can use. But you can order your own lab test in many locations in the country. So you can pay a few bucks, order your own test, go get the lab drawn, and have the result, and you'll know. Like I said, the mainstream range on the lab sheet is going to say about 3 to 21 or so. If your insulin level is 5 or less, you're probably in good shape. If your insulin level is 5.1 or higher, you have burgeoning, growing, developing, birthing insulin resistance. Why do I say that? Because any elevation in insulin is going to push hormones and chemistry out of balance. Okay? Insulin resistance, even when it's temporary, will cause hormone imbalances. What do I mean by temporary? Let's pretend that your fasting insulin level is 5. Okay? I see this on occasion. It's not real common, but on occasion, I'll have someone that comes to see me and will get their insulin level, and they'll have an estrogen level that's really high, testosterone that's really low, or vice versa. They'll have DHEA really out of balance, their thyroid's out of balance, but when I get their insulin level, it's 5 or 5.2. That doesn't sound like terrible insulin resistance. Yet when we look at their overall thyroid questionnaire, their thyroid questionnaire has a really high score on it. They report multiple problems and symptoms systemically. Lots of brain fog, fatigue, anxiety, maybe even a history of infertility, period changes in the women, They report weight gain, massive food cravings, especially sugars. So all of those are associated with insulin resistance. And so when you look at that whole picture and you see an insulin level, even at 5-ish, 5.1, 5.5, you think, oh, well, she doesn't have any insulin resistance. That's not true. If her fasting insulin is 5.5, then what's happening to it over the day when there are carbohydrates consumed? It's going high. So the higher it is in the morning fasting, the higher it gets during the day. So if you have a patient, if you are consuming large numbers of carbohydrates in the day with any one meal or 2 or 3 meals, or if you're grazing, I used to be a grazer, I literally snack all day. If you are doing that, you are spiking your glucose and your insulin all day long. That's going to raise your insulin level to 6, 8, 10, 12, 15 during the day. And then overnight, while you're fasting, sleeping, not eating, it's going to fall. And so you're having these ups and downs associated with your dietary intake. And that gradually is going to push hormones and all sorts of chemistry out of balance, even when you think your fasting insulin looks okay and normal and optimal. So even when you have 5-ish, 5 or right just above 5, you may be okay and not have severe insulin resistance, but it may be developing. You may be finding that you have early insulin resistance. Well, what do you do about that? Well, the same thing I've been teaching for the past 10 years. We try to limit the carbs. If carbs cause the glucose to go up and the glucose is causing the trigger of insulin release, then what's going to slow the insulin release? Decreasing your carb intake. And so it's a simple fix. It's just hard to put into practice because we like those carbs. We are addicted to those carbohydrates. We don't want to give up those grains because they taste good. They make us feel good. They're associated a lot of times with rewards from our childhood. They're associated with feel-good feelings and comfort food and those kinds of things. So for many of us, we have significant emotional attachments to food. That makes overcoming insulin resistance really tough sometimes. That's one of the reasons we talk about using a variety of supplements to help. I have a whole video on this page, on this Joyful Heart Facebook page called Supplements for IR, where we talk about using specific ingredients, supplements, and medicine to help you get past that craving, that management of your food and dietary intake. Any questions about how all that works? Does anybody have questions? I see boatloads of y'all have joined since I got started. Good morning, Mary Ellen. I didn't say good morning. Good morning, June. Good morning, Elizabeth, Lisa, Alicia, Barb. Good morning, Holly. Good morning, Cheryl. Sarah, good morning in Iowa. Good morning. Lots of y'all have joined. So if I missed you, I'm sorry. I'm glad you're here. So one of the most common problems associated with insulin resistance is one patients don't often connect, and it is joint discomfort. Frozen shoulder, plantar fasciitis, carpal tunnel syndrome, not necessarily the arthritises. Osteoarthritis is a degenerative process of the bone, so that's not usually associated with insulin resistance. Although the osteoarthritis can be inflamed and be more painful in the presence of insulin resistance. So make sure you understand that. Many people that eliminate their grains and drop their carb intake have significantly less osteo and rheumatoid arthritis pain. That doesn't mean the disease goes away. It just means the pain is more tolerable and less impactful to life. And that's really key, because even if you don't get rid of the disease, if you can function better in life, that's a win. Like, that's a win. Y'all have heard me talk many times about when I get wheated. If I have wheat, my hip is going to hurt. So I am going to avoid wheat if at all possible. I don't want to hurt for 2 weeks. It flares up my arthritis in my hip. I don't like to limp. I don't like to suffer with pain. When it flares, it's not just a mild 1 or 2 on that 10-point pain scale. It's about a 7 or a 8. And it impacts life significantly. Climbing stairs, doing any sort of walking, even like just down the driveway, like to the next door neighbor's house, like any of that kind of mild short distance walking is extremely painful for almost 2 full weeks. It takes about 10 or 12 days for that inflammation to clear my system, for my system to detox from that, and for everything to calm back down. And that's even with anti-inflammatory agents. I don't typically use medications. I typically use things like chlorella, resveratrol, white willow bark, CoQ10, like whatever supplements we have on hand, or what I typically use for that. But that does not feel good. You don't want to hurt on a big joint like your hip. You don't want to hurt for weeks. You don't want to hurt for days. And so if I have that to flare, I know I got wheated. Sometimes that happens at a restaurant when I don't know what's in a food. So I really try to be careful when I order at a restaurant. But joint pains can be really tough. Frozen shoulder is almost always associated with insulin resistance and metabolic dysfunction. So if you or a loved one is battling frozen shoulder, I implore you, get an insulin level. Get an insulin level. Get an A1C. Get those metabolic markers and see what's going on. My 20-ish lab panel graphic is on my Joyful Heart page. It's pinned to the top. If you'll go to the Joyful Heart page and scroll down just a little bit, there's a carousel of about 5 or 6 graphics that I keep there that stay right there. One of them is my lab graphic. You can see the labs I typically order. If you want to print that and take that to your prescriber and try to talk them into ordering those, you can. Or you can go to one of those labs you can order on your own and order your own. It's usually a couple $100, $300 to order them out of pocket without using your insurance. So yes, that might be a little pricey, but it's way better than your insurance bill if they don't cover it and you try to order it through them. Couple comments. Debbie Brown says, thank you so much. You've explained insulin resistance better than I've ever heard. I really needed this today. Oh, thanks, Debbie. Ginny Tab says 25 years with insulin resistance and MTHFR. MTHFR doesn't really have anything to do with insulin resistance. However, MTHFR has a lot to do with thyroid dysfunction and hormone management. And I have a whole video on the page about it. I find that most of my Hashimoto's patients have MTHFR. So there is some sort of correlation. I wish I had time to dive into that and dig into that deeper, but I have to see patients and don't have time to do tons of research. So if somebody wants to do that for me and send that to me, that'd be great. Yeah, insulin resistance is tough. I've been insulin resistant apparently my whole life. I didn't find out till about, 5 or 6 years ago. I knew something was wrong 10 or 15 years ago when I was gaining weight, but I didn't know it was insulin resistance at the time. Some of you have seen my before and after graphic, but some of you have even seen my grandmother, my mother, and me. I have a graphic where I share photos where I probably have a genetic tendency toward being overweight. And many people say, when I'm talking to them either as a patient or interacting on social media, I'll see people say, well, I'm just meant to be overweight. My mom was, my dad was, my grandparents were, like, I'm genetically overweight. Well, just because you have genes that predispose you to being overweight doesn't mean you have to follow that path. You can make dietary changes that make that different. I've not had genetic testing yet. I do have the kit. My daughter convinced me to do that, but we just haven't had a chance to do it. And so eventually I will get that done, but it will be interesting to see if I really do have a gene for being overweight. I suspect so, because lots of my family members in my history have been overweight. But you can break the cycle. I did. So insulin resistance, and the way we learn from our parents to cook and eat is what drives the majority of our disease. So insulin resistance drives cardiovascular disease, not cholesterol. Did y'all hear that in the back? It's not your cholesterol driving your cardiovascular disease. It is your insulin resistance and your inflammation. Okay? Okay. So, don't worry about your cholesterol. If your cholesterol is high, find out why. What's driving your cholesterol high? And fix that. And then your cholesterol will come down. Another tip, if you change your dietary eating patterns in any way, like any significant way, do not test cholesterol for at least 12 to 14 months, because it will take that long on that eating plan for your cholesterol to stabilize. Okay? I have patients all the time, or people that I work with, colleagues, nurse practitioners, colleagues, they'll send me labs to review with them, and I'm like, what happened to why did you even do a cholesterol? And they'll say, well, they wanted to check it. They've been keto, or they've been low carb, or they changed this eating plan or whatever. And I'm like, okay, well, 3 months into an eating plan change is a bad time to check a cholesterol panel, because that's going to change how the body is perceiving nutrition. And so lots of changes are happening chemically. You don't want to change, you don't want to check a cholesterol panel during those changes. Debbie Brown says, once a year I take my list of labs to my PCP, and he gets all I ask for. Insurance pays for everything. Good job. Mary says, you mentioned in the beginning rampant overproduction of insulin. What causes it? What causes overproduction of insulin? You tell me. What causes rampant overproduction of insulin? Why is insulin released? I said that too. Carbs. That's it. Carbs, grains, starches, taters, bread, rice, oats, cereal, pasta, all those things. That's what drives insulin up, and that's what drives insulin resistance. That's why I teach. Get rid of all that stuff. Stick to your, I call it a Christmas plate. Stick to your red meat, your green veggies, and your golden butter, your star. And then you're good. Your Christmas plate. Have it every day. Okay? Y'all have a great day. I hope this discussion of insulin resistance was really helpful. Keep in mind that insulin resistance impacts every single body system. Every system. If you think you have a symptom, you can probably attribute it to insulin dysfunction. So get you a fasting insulin, get you an A1C, get the rest of my lab panel if you can, and then try to figure out what you need to work on, what numbers are a little bit out of balance, and then you'll feel lots better when you do. All right, this is Jenny Gallagher with Joyful Heart Healthcare and Keto Nurses. Y'all have a great week. I'll see y'all around. Bye, y'all.